So I would request our chairpersons to introduce the speaker, Dr. Nancy, and start the session.
Good morning, everybody. First speaker for this session is Dr. Nancy Dhiman. Welcome, Dr. Nancy. Dr. Nancy has been a strategic implantologist for quite some time now. She is certified clinical masters for immediate functional loading of implants from Munich, Germany. She has been an IF teacher. She completed certified training in basic and advanced implantology from India and Korea under the able guidance of Professor Yong Chu from Seoul University, Korea. She is trained in advanced grafting procedures, advanced sinus lift procedures, hard and soft tissue management, advanced implant prosthetic procedures, and she has been a recipient of Healthcare Excellence Award by 94.3 FM for excellence in immediate functional loading of implants. She is currently practicing strategic implantology in Jalandhar with specific focus on immediate functional loading of implants. She has placed over 4,000 basal implants, and she is the director of 𝑘𝒃𝒃 Eye and Dental Care Center, Jalandhar. So we give to you Dr. Nancy Dhiman.
Hello, good morning everybody. Thank you so much, Doctor, for the kind words. And let's start off with the lecture today. Now my lecture today is on disciplines of strategic implantology. Now for any science to be predictable and to be reproducible, we need to have certain core principles or the disciplines. So I'll be dealing with those disciplines today. So we were talking about disciplines or the basics of the bicortical implant. So today we'll be discussing about the various disciplines or the methods where the implants are to be engaged for the success of the surgery. Now we have certain principles which deal with the second and the third cortical, which are the main matter of concern, and the significance of the second and the third cortical. The participants will get all the knowledge about them for the success of our treatment. So we start off with the surgical aspects of the basal implantology. Now basically what are we doing? The basal implantology, we are actually following the rules of orthopedics, and we are combining it with implantology to get our basal implantology. Now we need to have a thorough understanding of the bone before we proceed with any sort of surgical procedures in relation to the basal implantology. Now to outline it, we need to know how many types of bone tissues are there in our body. Now the first is the cortical or the compact bone, and then we have cancellous or the trabecular bone, where we can see that it's a spongy part of the bone. And we have two types of bone formation, that is woven or the immature bone, and then it matures into lamellar bone or what we call as the mineralized bone. So we need to have a four-dimensional view in our mind of the bone, where we need to engage the implants for the success of our surgical part. So when we are doing the surgery for the basal implants, the key points are the cortical bone. It has a superior mechanical properties as compared to the spongy bone, and it is an ideal support for immediate loaded implants. Now again, the compression along the vertical axis of the screw implant leads to the corticalization of the bone. So we have a cortical bone as a separate entity, and then we can also achieve the corticalization of the bone by compression of the spongy bone when we engage the implants. So we have various ranges which Dr. Rahul has also beautifully explained, and by them also, by engaging such implants, we can achieve corticalization in between the threads of the bicortical implants. Now this is a picture to just show you or give you an idea about the reduction of a fracture. Now in this, the principles of the orthopedics have been followed. Now what has been done is that the load transmitting surfaces, they are strictly cortical, non-parallel, and the placement to allow the macro retention